Good morning. During these unprecedented times, we're doing everything we can to make sure that we get the assistance to people who need it the most. When St. Louis County was awarded $173.5 million in federal CARES stimulus funds, I stressed that the money would go where it was needed the most. And that's why I brought advisors in with various different expertise and experiences to help us. We've provided more than $2.5 million to various community agencies who will distribute food in St. Louis County. We have set aside $17.5 million for small business relief grants, and we're in the process of awarding those right now with the help of the County Council. And we are asking residents in the most vulnerable parts of our community to help us spend $7 million in federal CARES Act funding on community health care services. This participatory budget model is designed after our unique recast community health program in our federally designated Promise Zone. This initiative focuses on violence prevention, youth engagement, peer support, and mental health. The participatory budget process will be built into more programs in county government moving forward. But this concept incorporates voices that are not often sought in decision-making process and really empowers our communities. For this $7 million allotment of CARES Act fund, we've asked 69 residents in targeted areas to complete a survey to help us determine their health care needs. And some of the survey questions included, what barriers to health care have been presented due to COVID-19? What barriers to accessing health care are already present in your community? What health care services have been disrupted? And what are the greatest health care needs at this time? Beginning Saturday, any residents who live in these targeted areas can begin to vote. Some of the items on the ballot based on the survey includes expansion of COVID-19 testing in high trafficked areas such as grocery stores or churches, more PPE including masks, gloves, more cleaning supplies, hand sanitizer, transportation services to medical appointments, coverage of co-pays or deductibles, and technology needs such as hotspots or tablets. Residents can begin voting tomorrow at stlcorona.com. We will have 30 more members of the community to help review and rank the proposals as they come in. We will have an RFP process, and contracts will then be issued to provide services in the targeted areas. The targeted areas include 18 zip codes that can be seen on the map next to me. All but one is in North County. The other is in the southeastern part of the county. Targeted areas were chosen based on census data, the rates of uninsured, unemployed, and areas that were hit particularly hard by COVID-19 in the county. We remain on track on Monday to increase capacity in our businesses to 50%, up from 25%. We'll also be starting some sports leagues in St. Louis County, including softball and baseball. St. Louis County has worked hard to get to this point, and we must continue to work together to make sure that we keep the spread of COVID-19 in our community in check. We are seeing some troubling numbers in other parts of the country. Yesterday in Texas, the governor hit the pause button in some of the reopening processes and moving on to the next phase in their state. We certainly will expect some more positive tests in communities across the country as they start to reopen and we start to see more activity. But large increases in numbers, large increases in positive tests for COVID-19 are evidence that folks aren't following the social distancing guidelines, aren't wearing a mask, aren't participating in frequent hand washing and other precautions. So please don't let these public health recommendations be background noise. Until we have a vaccine, we must be doing everything possible to prevent the spread of COVID in our community. In St. Louis County, our average positivity rate for the past week is down to 3.9%. That's a good place to be. And we'll continue to watch these numbers. We'll watch the reports from the St. Louis Metropolitan Pandemic Task Force, information from our public health officials as we find our best path forward. Meanwhile, it's important to continue our social distancing guidelines, stay 6 feet apart, wear a mask, and continue frequent hand sanitation. Thank you, and I would be glad to answer any questions.
Sammy, you talked about, you alluded to it there, these numbers increasing in parts of the country. I'm sure you saw the Missouri record cases 3 times in the last week, including yesterday. Fairly high number in St. Louis County yesterday, 88 cases as well. Does that speak to some concern on your part, or do you think it's more people being lax? I mean, I realize the 553 has something to do with some delayed testing results coming in, but what's your take on this? Should people be concerned?
Well, we don't think that we have a spike in St. Louis County. We do expect to see a little bit of a bump in the numbers. We'll be watching the trends more than the one-day numbers, but a little bit of a bump when we have more people out and about. We're doing more testing. That's to be expected. This isn't anything that would be considered a spike in our region, and we're certainly wary of what's happening in Southwest Missouri. But we'll be watching these numbers very close. We're going to be doing more testing. It's most important that we understand where these positive tests are coming from. If it's a specific place of business, if it's a specific facility, we get the resources there. We organize our containment procedures, we do our contact tracing, and we button everything down. And we will continue to see some positive cases moving forward. As long as they're organized around a specific location, we know where they come from, then that gives us some comfort. And right now, that's where we are.
And you had spoken to it there as well, the importance of people continuing to take these precautions as we move up to 50% capacity in businesses, sports start. People have to keep this in mind, and you still have to do these things.
Yeah, and if you want to understand what happens if we don't follow these precautions, look around the country. You know, some folks made different decisions in their reopening procedures, and we're starting to see the consequences of those decisions. Decisions on reopening perhaps a little bit too fast, and now not wide acceptance of social distancing guidelines in other parts of the country, I believe have given them some challenges they'll have to work through. But it's very important in our community that we follow our social distancing guidelines, that we're out and about, we wear a mask, that we continue with our frequent hand washing, and we're doing everything possible to contain the spread of COVID-19 in our community. And if we do that, I think we'll be in a good spot moving forward.
But you don't seem overly concerned at this point about the 553 number in the state.
Well, we know where that's from. We know that that's from, for the most part, a couple of food processing plants in Southwest Missouri, and then a little bit of a bump across the state. But what we see here in St. Louis County, the cases that we have had from yesterday, we know where some of those were from, and we can focus on those areas, get our contact tracing in place, and track everyone down, give them the proper advice, quarantine when possible. But it is very important that we continue our social distancing guidelines as we take the next step forward on Monday and begin expanding some of our capacity in our businesses.
Guys, just a logistical question about what you're showing here. People can go on and vote for how they want the services allocated. Is that my understanding?
Yeah, so this participatory decision making is a relatively new concept. We've used it some in county government, where we let individuals in the community determine what resources they would like to see. And so we are asking individuals who are in this promise zone area and other high need areas based on unemployment, uninsurance, and where they've been heavily hit by COVID-19, we're asking them to vote on the types of services that they would like to have, whether that's more testing around grocery stores, more PPE, or these different categories. They'll tell us what categories they want to see, and then we'll open up a request for proposals for nonprofit groups in the community to apply to provide those services. And then the residents who are the delegates elected, or that have been elected from that community, will then decide on those RFP proposals. So we're letting the residents vote on their needs, and then we're letting them vote on the proposals that come to provide those services.
What's important about this, do you think?
Well, I think it's important to engage residents in our community in helping to decide what services that they receive. And this is called participatory budgeting. It's a very important concept, especially in our promise zone. We definitely want residents who are receiving some of these critical services related to access to health care and COVID testing to help us determine what sort of services they want to see. Okay, Doug, you have anything?
No.
Okay, thank you.